This is the operating theatre, or the operating room, as it's sometimes called. To my right is the preparation area where we scrub up and we gown before surgery. The duration of surgery is between 4.5 to 6 hours. And the operation is usually performed by the senior surgeon with a senior surgical trainee and a senior nurse, a scrub nurse. You may have heard the terms two-stage and three-stage operations, and I'll try and explain to you simply what that means. Two-stage means that for us to do your surgery, a cut or an incision is going to be required in the belly or abdomen, and also an incision or cut required in the right side of the chest. We do that operation where the cancer is in the lower part of the esophagus or at the junction between the esophagus and stomach. A three-stage operation means simply that in addition to a requirement for a cut in the abdomen and in the chest, a third cut is required, a small one, in the left side of the neck. And we require the three-incision or three-stage operation where the cancer is located in the middle of the esophagus or the upper part of the esophagus.
You know, a lot of the thing as I went through this was kind of the mental approach. You know, you have a physical condition, of course, that you have to fix, but a lot of it was trying to build and maintain mental strength and a kind of a positive attitude to what you're going through. As you can imagine, from the very first outset, the term cancer sets all the worst possible signals. But as I've gone through the treatment, I realized that you know, in this particular cancer, with my fortunate early diagnosis, that I had a pretty good chance of coming out of this alive.
When the patient is sent for theatre, they will be escorted on a patient trolley by the ward nurse and the theatre attendant. On arrival, they will be taken into the reception area where they will be checked in for surgery by the reception nurse and then again by the anaesthetic nurse. It is important that these checks are carried out in order to ensure that we have the correct patient for the correct operation.
When the theatre is then ready for the patient to come down to the anaesthetic room, a nurse will go up to the holding bay. They will actually go through all the checks again to make sure that nothing has been missed out on the ward. They will then bring the patient down to the anaesthetic room.
Hi, I'm Dr. Niall Hughes. I'm one of the consultant anaesthetists in St. James's Hospital. I've been working closely with Professor Reynolds for the last 15 years or so as he performs this type of surgery which you're about to undergo. We've developed a lot of expertise in this area, and so the first thing I'd like to say to you and your family is that the vast majority of cases go very smoothly. Now, we do consider it to be a big operation. You can expect to be in theatre maybe up to 6 hours or more, but the vast majority of patients will be sitting up in bed in the intensive care unit by evening time. When we bring you to the operating theatre complex, we will bring you to an anaesthetic room, and it is here that we prepare you for surgery. Here you will have a number of drips put into your arms or the side of your neck, and it's here we perform the procedure called an epidural. You may have heard of epidurals for women for the relief of pain in labour, and this is the sort of technique which we'll be using for your operation. When you wake up, you will be back in the intensive care unit, and we will monitor you closely there for a few days, and we will use the epidural during this time to keep all pain at bay.
There are a few issues I want to inform you about with respect to the operation of esophagectomy. It's a very major operation. can take up to 4 to 5 hours to perform, and the average length of stay of a patient in hospital after surgery is between 2 and 3 weeks. And for the majority of patients, it takes about 3 months before they recover quality of life. It's viewed as a very major operation because for most patients, the operation is performed in the abdomen as well as in the chest. And because both compartments are operated within, the risk of problems and complications is greater than for most other operations that are commonly performed. The major complication is pneumonia, which occurs in approximately 20% or 1 in 5 patients. In some cases, the pneumonia can be so severe that the patient needs to go back into the intensive care for ventilatory support. Another complication is the failure of things to heal properly after surgery. This occurs in approximately 1 in 20 cases, and that can sometimes lead to a significantly prolongated stay in hospital. Clearly, the most important risk of any major operation is the risk of dying from the complications of surgery. And in our series of over 500 cases performed in St. James's Hospital, that risk is approximately 4%, or 4 in every 100 patients. And that figure is consistent with the results reported from the best esophageal centres internationally. What is the cure rate for esophageal cancer where it presents confined to the area of the esophagus? Well, this depends on how early the diagnosis is and can range from an overall cure rate of 40% to much higher than that if it's been caught at an earlier stage, or if the chemotherapy and radiation therapy that's occasionally given has had a dramatic effect on the cancer.